health news tonight, limiting the number of medical mistakes. They happen in hospitals all across the country.
News 8 medical reporter Jocelyn Mamenta on the scene in Hartford with a look at how the team approaches working at St. Francis Hospital to decrease the risk of medical errors.
Just minutes before heading into the operating room to remove a lymph node in her neck,
So what we're going to do is we're going to make an incision on the outer part of your neck.
Tony Hassler undergoes another thorough check, this time from her surgeon, Dr. Scott Elner.
Actually, more than once, all the nurses, the doctors, everybody, they went through everything step by step, 3-4 times, just to double, triple check.
The surgical area is also carefully marked, so there is no confusion. It's all part of the Safe Surgery Checklist, now in place at St. Francis Hospital and Medical Center. The process is about patient safety.
We did our own study here and looked at 75 cases using the checklist, and we found a significant reduction from 21% complication rate to down to 6%. The script is started by anesthesia.
The close focus has patients like Tony comfortable with their course of treatment.
I think it'll be just fine. Just a quick, simple, easy thing to do.
Complacency, says Dr. Elner, is the #1 concern.
We forget to check name bands. We forget to discuss with the patient that the procedure that is intended is outlined in detail so they're properly informed.
So patients here go through 4 rounds of thorough scrutiny, including 2 right in the operating room.
We're going to do a left cervical neck lymph node biopsy. The left side is still marked.
Everyone involved has a role to play. A timeout script, complete with questions to be asked, is critical to the teamwork approach.
And everybody understanding that doing something in a fashion where we're all prepared, we all have the same idea of what to expect.
Just so everyone is on the same page, the last debriefing occurs after surgery is completed and before the patient heads to recovery.
Specimen is left neck lymph node.
Yes.
Lymphoma workup, our counts were good. Okay. And for the next case, we're going to do a right inguinal hernia.
Dr. Elner is working with state legislators so that the timeout script becomes standard operating procedure in every Connecticut hospital. On the scene at St. Francis Hospital, Jocelyn Mamenta, News 8.